Hello and welcome to yet another session of our Vision Pack series. I'm Vidyut Joshi. I happen to be the research and content head at Bablr, and I'm going to be your host for this session. So, it's really good to be with all you wonderful parents, and I really appreciate this time that you spare for the session. In spite of it being a working day, I really appreciate that, and it actually encourages me to believe that you are taking your job seriously. So your job as a parent, that's a very, very important job. So on that note, I would just like to share a little tip with all of you parents. So whenever you're interacting with your little ones, your babies, remember interacting in any way, may it be a conversation or an activity that you're doing. Remember five points. Okay, the 5 points are focus, focus, that is both you and your child are focusing on the same thing. Encourage your child to ask, talk about things, name the thing that you're focusing on, take turns when you talk or do any activity, and practice the end and the beginning of anything. So these 5 points are the key points for a technique called as serve and return. If you keep this in mind, it's I'm sure your toddlers will be engaged with you at all times, and you all will have a blast of a time. So that was just a little tip that I just wish to share with you all. And so coming back to our session, so today's session is actually about teething. We had the last one with Dr. Tejal, if many of you remember Dr. Tejal Kanwar. It was on healthy babies make healthy adults. And this session happens to be the 14th one in the series. So for those of you who are a part of who have been joining these sessions, you'll already know that we bring you these monthly sessions, and we have an expert joining, and the expert is in a particular field. So that you parents can interact with this expert on this particular topic, and we try to like sort of ask them questions which we anticipate parents may have, and then towards the end of the session we open it out for everyone to interact with the expert. So that's how our vision pack session works. And so far we've tried to include the various domains of brain development in the child. So we've included things like emotional and social intelligence. We had a storytelling session, then we had some flashcard sessions, then there was a positive parenting session, right habit formation, even a very interesting baby movement to expert skills session. So all of these sessions, they are available on the YouTube. If you all have missed, you all can go and have a look at it. So we try to bring you these from different various domains, as I said. And if you have any suggestions or any ideas about what will be useful to you all, we'll be more than happy to bring any of these sessions to you all. So let us know. So today's session is about, is called teething and beyond. So we all know that teething is a process that all babies must undergo. And although it's a very important and kind of a momentous stage, it's not a fun one, not a fun one for the baby also, and not for the parent also. So because of this, discomfort and stress that is associated with teething, it's very important that we as parents understand what to expect during this time. In fact, it's not only teething, but it's important to know about it and continued oral health as well, right? So healthy teeth are very important for a child's let's say on overall health. So what they help you is they help your child to eat and even talk properly. So this strong oral care, it helps build good dental habits as your child grows, and poor oral care leads to infection, disease, and some other teething problems. And in fact, there's a survey which was done, which says that most tooth decay is the most common childhood disease. So yeah, it is a disease. You might be surprised to hear that. So, but the good part is what? It is, of course, it's preventable. And if we act early on, it's even more preventable. So the health of the child's mouth, it can it can affect various aspects of the child's life. So, like we have toddlers, so we know we are getting them ready for school. School readiness has become a buzzword nowadays, but it's very important to understand. See, all this physical, social, emotional, language, and cognitive development, all these are what we're thinking of. But even oral health impacts each of these areas. These are very important to keep in mind. So parents who happen to be the primary, we are there with our children right from the time they are born. So they play a pivotal role in this whole thing. So let's try and understand this whole concept in this session today. And so that's this whole session going to be about. And I promise you it's going to be a great one. We have very interesting people with us. And on the lighter side, I would just like to share one little limerick. It's by a poet called as Odgen Nash. I don't know, maybe some of you have heard of him. So some tortures are physical and some are mental, but one that is both is dental. Sorry. So, so meeting a dentist was something I dearly hated. And it always had this image of, a mask clad figure with a machine in their hands and a gleam in their eyes. But today I am really, really eager to meet not one but two dentists. And they're going to help us understand a lot of these dental issues. So today we have with us Dr. Gayatri and Dr. Tejas Parekh. So they are practicing general dentists and consultants in several hospitals all around Mumbai, and they have their own practice as well in Mumbai. So they have a good 10 plus years of experience in this field, and they're going to share some wonderful insights with us today. So let's make the most of this opportunity. So welcome, Dr. Gayatri and Dr. Tejas. It's great to have you with us today.
Thank you so much, Vidyut. Hello, everyone. So, thank you, Bablr, for this great opportunity to, for us to interact with you on this Vision Pack series.
Yeah, great. So, all your questions, as in when you think of questions during the session, feel free to type it in the chat window. We'll take up all the questions towards the end of the session. And this session is going to have a longer Q&A, like a 45 minutes Q&A we are going to have. So we'll have a 45 minutes discussion and a 45 minutes Q&A. And some of you who have missed the earlier sessions, you all can visit our YouTube channel, can get in touch with our customer support. They will guide you through it. So before we begin, there's a little disclaimer that I always read, and I would like to read it even today. So let me do that. So this session is not intended to give any personal medical advice. We are only going to mention broad and general accepted principles and practices. So please consult your doctor or specialist about all specific questions and circumstances. Okay, all right. So with that underway, let's begin. So parents should be concerned with dental hygiene even before their teeth are visible, right? So what are the best practices to keep your mouth clean, Dr. Parekh?
Yeah, so I think no, normally we have this opinion like, yeah, abhi tak to there's no teeth in the mouth. So why do we care about and what do we care about? Like there's not even a single teeth in a newborn baby. Yeah. But actually speaking, that is not true. The cleaning of the gums should be started since 1 week of the baby's birth. And that is because, it's not necessary that only teeth need to be cleaned. The entire mouth needs to be cleaned. And that is a myth that we always think like there is no teeth, so no cleaning is needed, because what is there to clean? There is no teeth, no cavity, nothing.
Right.
But really speaking, because the child is feeding, yes, we need to clean the gum pads. And that is very simple way to clean it. Just take a piece of gauze, dip it in water, and just clean the gum pads. That is it. And that should be enough for the baby.
Right. Right. So you're saying even in the first week of the child's appearing, you need to have that.
Yes, since after the first week, we should start cleaning the gums.
Right.
And so, as well as the tongue too.
Right. Okay. So yeah, I guess up to the first 6 months, a baby is probably on breast milk, or yes. So probably there may or may not be infections. So what about babies who have formula milk also? Do they need to take special care? I mean, like as you said, you just clean it with a gauze or something. But could there be, because of this feeding and milk, all that, the layering on the, I think the tongue and all that, it's
Yeah.
called thrush or something like that, if I'm not
Yes.
mistaken. So what care should be taken there?
See, normally, like we say, the breast milk is best for the babies till 6 months of age because
Right.
it itself has antibodies present in it, which prevent any sort of infection to happen.
Oh, okay.
And in case the baby is formula fed, also, thus we just need to check that there is no sugar content in the milk because that can harm the further teething process. So
Right.
sugar is a complete no at that moment.
Right.
And all elsewise something called as thrush. So what exactly it is? We normally see babies with the white layer over their gums or their tongue, and that is at times normal because after feeding, babies tend to have this kind of a layer which can just be wiped out with a gauze.
Uh,
At times when the babies are irritable while wiping it out, or it starts bleeding after that, or there it still stays even after wiping, so that is
uh,
a part of concern, and that could be because of some kind of infection.
uh,
So how actually will babies contract infection?
mm-hmm.
So that could be because of some use of some bottles which are not sterile properly, they are not cleaned properly,
uh,
or it can be passed through mothers also in case the mother is on some kind of medicine
Right.
or some lotion that has been applied. So no, normally babies don't develop infection on their own, it is
Mm-hmm.
mostly passed on. So we
Right.
just need to be careful, like not everything in is infectious, like just a layer and it's not infection necessarily,
Right.
so we
Right.
need to wait.
Correct. Okay, so you mentioned about, cleaning with a gauze. So when you're saying a gauze, like you mean the one that is there in the medical kits, like you have
Yes,
the, ah, okay.
yes. So you can just dip it in warm water and just clean it.
Uh-huh, uh-huh. I see. That's good. Okay, so now an important thing is about teething. I think that is a very, very trying period in baby's life, both of course for the parents as well, because the child can be very irritable at those times. So, what care should, or rather, what advice would you give our parents during that time? What should be, what should they do, and when do their first teeth really appear?
Yeah, it's a very excitement moment to see the first tooth coming in the child's mouth.
Yeah,
It's actually one of the milestone in the
absolutely.
development of a child.
Yeah.
So normally first tooth comes around 6 months,
Mm-hmm.
and it gives an anxious moment also because of child becomes irritable, it
Correct.
becomes fussy, keeps on crying, don't eat properly.
Mm-hmm.
So it's an absolutely normal child to being irritated because of the teeth coming out.
Yeah. Yeah. Okay. So one need not worry too much
Worry
about it.
about it.
It's just a test of your patience, I suppose.
Exactly.
Really.
Yeah. So, but I believe some of the children, they run a fever, or their gums start to bleed or something like that. So, would that be something to worry about, or even the parents? That's two questions I would like to ask you. That, and like people tend to use, parents tend to use these teething products. So how safe are they? Also, should we
Yeah.
use them in the first place?
Right. The local symptoms like, as you said, the bleeding gums or the gum become reddish. That
Mm.
is thing normal because it tooth pushes through the gums. It would
Okay.
be absolutely normal to see in the mouth. Consider up to 8 days from the beginning of the all the
Okay.
and the second part the fever part.
Uh-huh.
Fever, diarrhea. It is not actually associated with the teething part.
Mm-hmm.
Might be during teething the child is irritated in the mouth, so it keeps on putting everything inside the mouth.
Right.
So there
Right.
are chances to get cross-infected or
Uh-huh.
something.
Uh-huh. Okay.
And the second part of a question,
Mm-hmm.
what? So to reduce the irritation in the mouth, we can use various teething toys.
Right.
It can refrigerate it, so the cold feel of the toy may
Mm-hmm.
give a soothing effect, or you can even give the toast or hard fruit like apple, pear. So
Okay.
everything helps to reduce the irritation in the mouth, and the
Mm-hmm.
child behave less fussy then.
Right. Right. Okay. So you're saying that this, the first part which I asked you about the gums being irritable or whatever. So that's, you're saying, is okay for about 1 week. That's what you're saying, right? I
Yeah.
mean, And after that, if it goes beyond that, then there's something to worry about.
Yeah, then you need to visit a doctor.
Okay. And the teething products, yeah, they may be like, even you said about refrigerating and all that. I think some of them have these gel
Yeah,
and something
yeah,
like that. So it's okay to refrigerate those as well, is it?
Yes.
yeah. It will
Because
help out. It will help
Okay.
it out, giving a soothing effect to the child.
Uh-huh. Okay. But I like the idea of giving a fruit,
yeah.
because that's more, I think, organic, and why
That
give
even
any
develops
chemicals?
the taste for the baby. Like the
Absolutely.
baby is not yet weaned,
Yeah.
so when it's teething, you give some kind of a hard fruit, but that should be under parental control. Like,
Of course, because it shouldn't
yeah,
be choking hazard.
yes,
Na?
Okay.
yes,
Yeah,
yes.
absolutely. Yeah, that's good. So so there's another question that comes to my mind when we talk about these sort of teething products and all that. So children, there are certain childhood habits that children pick up, like maybe they are sucking a pacifier, or for that matter, their own thumb. I believe as a kid, I used to do that. I don't know. My mom says that, but maybe. So how does it really does it actually affect the teeth and gums, or would it cause issues later on? Maybe.
Yeah. So use of a pacifier these days have become really very common.
Hmm.
But what I would suggest is, the kids have a tendency to suck. Like they have this suckling tendency because they are breastfed, and even when they are in the, when they are in the womb, they have this sucking habit. They develop it
Ah,
quite early in their life.
right.
So just, because they have this habit, the pacifier will help to curb that. They have that urge to keep sucking on something.
Right.
So a pacifier can be used to, curb that urge, but not actually to, quieten the child. If the child is crying, you just give a pacifier, the child will
Mm,
stop crying. So
correct.
that is not really what should be done.
Mhm.
Because, later on that becomes a habit for the child.
Absolutely, yeah. Yeah,
And
yeah, I
yeah,
think parents tend to do that, especially mothers.
yes,
अरे
yes.
मुझे ये अभी सब्जी पकानी है, अभी pacifier
Ha,
डाल दो
that's
कुछ.
true. That's true. See, when the child is like below 1 year of age, it's very easy to just remove or wean him off the pacifier. But
Mm,
as the child grows, he
right.
you know he starts using his sensory. He starts using his senses. So he knows, "Okay, if I want a pacifier, I'll create a fuss. My mom will give it to me."
Correct.
The
Absolutely.
child are very smart these
Yeah.
days.
Yeah. Yeah.
So this
Right.
habit should really be stopped at a very young age.
Right. Right. Right.
And as far as thumb sucking is concerned, I think, all the kids have this habit because when they are from the breastfeed, they go on to normal food.
Mm-hmm.
The bond between the mother and the child, that also gets
Yeah.
a bit affected because when the baby is breastfeeding, the bond is little different.
Correct. Correct.
So there are some insecurities within the kid also. And
Mm-hmm.
that leads to thumb sucking. The
Right.
kid starts sucking his own thumb to have that feeling of sucking.
Mm-hmm.
So that is actually normal till the age of 1.5 to 2 years. But
Mm-hmm.
after that, we need to make the child understand. Normally, the child gives up on its own because when he starts eating food, he's
Right.
involved in different activities.
Correct.
The thumb sucking habit just goes off on its own.
Uh-huh.
But if it's beyond 3 to 4 years of age, then yes, it is a part of concern for the parents as well as the child,
Yeah.
because later on the thumb sucking can cause lots of other disturbances, like it can cause your alignment of the teeth may get disturbed because
Uh-huh.
till the age of 3 almost all your teeth have erupted.
Right. Right. Right.
So after that, if the child is still sucking on his thumb, then the alignment of the teeth will just change.
Mm-hmm. Yeah,
That
but
can lead to many other
so you're
problems.
saying like after the age of 3, parents should definitely put a hard
Yes,
stop to that.
definitely,
Yeah.
definitely, you need to
Yeah.
visit a specialist then for sure.
Yeah. So, but I guess it's best to, stop it in nip
Yes,
it in
at
the
the
bud
earlier
itself.
age,
Yeah,
when the kid is young, it's easier to make him understand.
absolutely. Yeah, right. So we have to be mindful about this thumb sucking.
Yes, yes.
And coming back to this thing you mentioned about food habits, I think these are also very crucial for oral hygiene. You even talked about, even in the formula should not have
Yes.
sugar in it. So sugary foods are very tempting for children, and they are
Yes.
so they
I
are
think even for adults, for everybody.
yeah, right. And they are harmful for the teeth. So they cause all. Can you just tell us about how it affects the teeth, and why should we be mindful about it?
So normally, I think even as adults, we cannot control our urge to have a chocolate, right?
Yeah.
I really suppose everybody has this thing, a craving for a chocolate. So obviously,
Absolutely.
kids are no different, and it's actually more tempting from them, as that's something new for them.
Correct.
But
Correct.
yes, the sugar intake should be well under control, as more of sugar will cause more of decay in your teeth. And
Mm-hmm.
as far as decay in kids is concerned, it will surely be a nightmare for the parents, I suppose.
Absolutely. It
Yes.
definitely will be. Yeah.
Yeah. So normally what we can do is, nobody is going to stop eating chocolates or any other sugary foods. So instead we can just limit having these chocolates during meal times, because
Hmm.
anyways we are having food sugar content will be there in our normal food. Like
Right.
even the roti chapati has some kind of sugar content. So
Right.
when a child is given a chocolate or something during that period of time, so that will cause less harm to the teeth.
Right. Right.
As
Right.
far as possible, we tend to avoid having such kind of a thing. But I think in today's fast forward world, junk is something which is a part and parcel of everybody's life.
Yeah, it's there to stay, I suppose, although we should
Yes.
try not to let it stay. But
Yes, but it is. So
yeah, it is.
I think limiting it to a specific time, because in between meals, if the baby or the kid keeps on
Hmm.
having some sugary kind of things, that might lead more, the babies are more prone to decay then.
Right. 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 Yeah, so there was this one friend of mine who she didn't know what to do about it. So she came up with a very nice thumb rule. She told her little toddler, 2 year old, अच्छा आपको खाना है sweets खाना है chocolate खाना है no problem you eat the chocolate but only condition is go and rinse your mouth. So
Sure.
does that work?
Yes, really, it really works. Because how actually the decay occurs is when you have chocolates or whatever sweet thing, so
Yeah.
that your mouth becomes acidic. And that
Mm.
is the main cause of decay. Like your mouth is acidic, that will go on making, create decay in your teeth.
Right.
So when you rinse, your acidic pH goes on decreasing. So the acidity in the mouth decreases, and that will cause less decay, or the less prone
Right.
to create decay. That is not a thumb rule that it will not cause any decay, but yes, it does
Yeah.
help, and it does help to a great extent.
Yeah. Okay, that's good. I must call up and tell her that was a good tip.
Yeah, actually a good thing.
Yeah. So sometimes parents do tend to think, like these are just milk teeth. They're going to fall off anyway. So why should I bother? Hmm? How? What would you say to that kind of thinking?
Yeah, it's absolutely a wrong thinking,
Ah.
because actually the milk tooth has the foundation stone, a blueprint to your permanent tooth.
Okay.
So if anything miss goes into the blueprint part gets deleted, and that would affect your further plans. So
Uh-huh.
actually the milk tooth has a major factor like playing roles such as chewing habits. It helps in develop the speech. It
Mm-hmm.
helps to maintain the space in the mouth along with the growth of the jaw. So it's better to save the tooth than removing it out.
Oh,
But
right.
as like all people, major of the people think
Hmm.
a milk tooth it will fall down anyways.
Correct.
So
Correct.
don't treat it or just keep on extending for the treatment part.
Correct, correct, correct. That's very interesting. So it's like a, as you said, a blueprint for the permanent teeth to come out. So it's all the more important if you know that fact, then you will definitely make sure that अच्छा उसका foundation ho and it
Oh,
Yes.
doesn't get decayed. Yeah, so it's very important to think about it that way. Yeah. So I guess when we're talking about teeth, what comes the next thing that go with teeth is toothbrushes. So
yeah.
when is the the right time to get your baby a toothbrush, and could you tell us what kind and even maybe what type of toothpaste should one use for a toddler?
Yeah, absolutely. Actually, the when the first tooth come into the mouth, the cleaning process start
Hmm.
with the brush. So initially, the finger brush is used, or even the wet gauze is used
Okay.
to clean the very few teeth in the mouth. Once the teeth come, then start using the small brush. The size of the brush should be small, which helps to get the proper cleaning of the teeth. Even the bristles of the brush matters. Bristles
Right.
should be soft, just to prevent harm to the gums.
Mm-hmm. Hmm.
And the toothpaste part. definitely initially the small amount, like a pea size of a toothpaste, should be taken on the brush.
Mm-hmm.
And initially, up to 3 years of age, non-fluoridated toothpaste should be used because of the child would ingest the toothpaste and might
Right.
lead to the systematic problems due to the fluoride in the toothpaste.
Right, right. So when you're saying the toothbrush, like initially you're saying that the parent should use the toothbrush for the child, right? So it's
Yeah,
like you said, what did you call it?
Finger
Finger
brush.
finger
It's a
finger
brush,
finger
brush.
brush.
Yeah. So a finger brush which fits on the parent's
tip
finger
of the
and they
finger.
can
Yeah,
Yes,
brush it
yes.
like that. I see. So you start with that, and when the first tooth appears, the mother should do that.
yeah,
Yes, yes.
I
We
see.
need to start it as soon as the first tooth
tip of.
appears.
Okay. And then later on, when can the child then have the child do the brushing? So you'll have to modify the toothbrush. What should that be like?
Yeah, actually starting with the finger brush, then starting with the small brush. The
Okay.
brush now it comes with a variety of colors like neon color,
Yeah,
cartoon
yeah,
handle.
yeah.
So just like motivate the child. So initially, the parent are the primary caretaker,
Right, right.
even for the oral hygiene. The
Correct,
child won't brush himself. So
correct.
initially, the parents need to clean twice a day is the thumb rule for the cleaning part.
Mm-hmm. So that is what I mean. It's the responsibility of the parents to kind
Parents
of
too.
ensure the child is brushing properly. So how
Yes.
can we like sort of motivate them? Like, of course, the toothbrushes, buying those fancy toothbrushes, maybe even an electric one, those are available in the market. Those are important in the sense like it's just a hook that catches a child's attention. But how does one ensure like अभी ये ऐसा करना है आपको? And this is the way to brush. How can we like any tips on that for the parents?
See, normally I people use manual brushes, they use electric ones. Both of them, give a equal amount of cleanliness. But as far as powered ones are concerned, you don't have to literally move it. It just
Right.
works on its own. You hold it and it works.
Uh-huh.
So
Right.
that will, motivate the child because it doesn't have to do. It is fascinating, like something a machine is like
Yeah.
moving around.
Yeah.
So that really helps, building the confidence in the kid. Like, yes, I'm doing something new.
Uh-huh.
And normally, the way we brush, we always need to brush in a circular motion for the kids,
Right.
especially. So
Right.
while teaching them, you can teach them, just to make it fancy and exciting. Now make a
Right.
big circle, then make a small circle, then bring
Yeah.
it to your, and again make circles.
Correct.
That will
Yeah.
really help, engage the child into this brushing process because normally kids are like, I don't like brushing. I don't want
Yeah.
to do it. That is the
Yeah.
first thing when you take up in the morning, brush karo. No, it's always a no from the kid.
Yeah, absolutely.
Make it fascinating.
Yeah, so it's very important that parents also, they show how the child maybe they brush with the child, it can be
Yes, that
something
will
like a
really help.
yeah. I remember my dad he had told me this, when I was little, he used to say, it's up and down, small circle, big circles, in and out, and we used to do that drill every time. So
Yes.
I automatically, even today, I remember that, oh, okay. Whenever I brush my teeth, I remember my dad. So I guess,
Yeah.
yeah.
See, if you still remember it, if the parent teaches the kid at the age of 0 to 3 years, then I think lifetime this thing is gonna be in the mind.
Absolutely, yeah. So I think it's really important. And the parents play a very, very important role, even in a small activity like this.
Yes, that's
Yeah.
true.
So even we should check our own oral hygiene. Very often, sometimes even when we have, I shouldn't say this, but if there are meetings or something, sometimes you do, when people open their mouth, you feel, oh my God, I wish I was sitting far away.
Yes, true.
So we should be really mindful about that. And I think it's very essential to have that. So there is this thing about flossing. I learned about it maybe a few years ago, but as a kid, I never knew about it, and maybe it was not so prevalent also at that time. So, do you think children should floss, and is it possible to make them?
Yeah, actually, it's again same thing. Back to the initially parents need to teach the child.
Uh-huh.
So flossing is there is a gap in the milk too. So their food particles are stuck between the teeth.
Right.
The flossing definitely helps to clean that area and prevent the cavity or decay
Right.
in that area. Now the small handles, again the fancy handle comes
Yeah.
with the floss, so it helps to just clean the teeth and motivate the child.
Right.
And then that is the habit which starts here and goes up till adult.
Correct. So, but
Yeah.
there was this one thought that somebody put in my head, like when you do that flossing, ये जो gap होता है teeth में वो increase हो जाता है. Is that true?
No.
No, not really, because kids normally have gaps, like because those are milk teeth, so there are gaps between their teeth, and it is very normal because
Right.
your milk teeth size and your adult teeth size are different.
Right.
So when they fall off and when the new teeth comes, the size of those teeth are bigger,
Right.
and those gaps gets filled up on their own.
Okay.
So ideally, there's nothing to worry about it. But yes, when your teeth are like already in a tight place, they are placed very tightly, then yes, flossing will surely be of great help.
Okay. So it's important. I think even maybe as kids, if I didn't learn it, maybe I should make sure that my child does it anyway. It's very important. Okay.
They'll have a healthy habit since childhood, and that will really help for when they turn into an adult. It is easier to adapt to that change.
Correct. So I think we should make a discipline about these things. Like I think Dr. Tejas or he did mention twice a day or something. Can you give us that rule again? What you said?
Cleaning is required twice a day.
Uh-huh.
Brushing is required twice a day.
Okay. So it's like in the morning when you get up and before you go to bed.
Yeah.
It's not really required to brush your teeth after every meal, right?
No.
Okay.
Not really.
Not yeah. I mean, it's just rinsing your mouth is enough. Yeah. So that's good.
Because excess brushing is also at the end not really good.
Not good, I guess. Yeah. So it might affect the dental enamel or something like that.
Yes.
Okay, very good. So there's another question that as kids they are all jumping about, playing and things like that. So they are definitely bound to fall, hurt themselves. It's possible they might fall and maybe a tooth breaks or they hurt their gums. That can result in a big problem. So any tips on how we should handle such a situation?
See, normally at this age, they're going to learn to walk, run, and jump around, as you said.
Right.
So when child fall and even if a teeth breaks or a tooth part break, try to bring that part to the dentist as early as possible.
Okay.
Because that can be fixed on the tooth and the tooth can be preserved.
Okay.
Otherwise, if even tooth comes out, just bring that tooth to the dentist as early as possible. The more early you bring, the more successful it will be placed in the mouth and it stays longer.
Okay. So you're saying, if I'm understanding correctly, you're saying that the tooth that has fallen off, you preserve that tooth and take it to the dentist, and they can put it back in your mouth.
Exactly.
Oh, that's very heartening. Asher? Okay.
Yeah, it's a way to save the tooth. As much as possible, we can try to save. If it fall in the clean area, just bring in the milk, because milk is easily available at everyone home.
Okay.
Everyone place. Or otherwise, there are solutions available in the chemist. You can take in that also. But the main rule is that bring as early as possible to the dentist so he can help it out for the further line of treatment.
तो मतलब अगर आपका बच्चे का दांत गिर गया है कि कहाँ पे, you are saying you pick it up and put it in a glass of milk and you and the kid and the glass of milk go to the dentist straight away.
Yes, straight away.
As early as possible.
Best results are obtained within half an hour.
So this is a new one. I mean, putting your tooth in milk. I know milk is required for the teeth, but this is a new one.
See, there are many solutions available in the market as well, but by the time you go to the chemist, you get the solution, we run out of time. And then it is difficult for, placing it back into the mouth because, the tooth becomes dead by then.
Okay.
There are a few fibers on the root. We need to preserve that and to keep as moisture as possible, not to dehydrate that.
Okay.
So important is to place in the milk, would be the best, easily available. Then there are others, as we said.
Yeah.
Very interesting. Similar to the solutions available in the market. So milk helps.
Okay.
Not like better than water. Not water. Milk will be a better option.
That's a good tip. I think it's a very interesting tip that you all have given. Very nice. So, but that is about the teeth. But what about the trauma that the child is undergoing, like the screaming and shouting? Anything that you can calm them before we bring you. You might be facing a lot of kids
Yes.
screaming and
Yeah, definitely.
shouting.
Yeah, normally after a fall, the kid is so scared. Like they are
Right.
scared of, what is going to happen. Maybe it bleeds, or the tooth breaks, or it falls off. Even if it pains or not, the child is so scared that he's going to scream out, and
Yeah.
scream out like really bad. So you
Yeah.
just need to calm down, like nothing is going to happen, and we are just going to check him. And no, don't not going to directly go to some procedure unless and until the tooth has come out before its
Correct.
age.
Correct.
Uh,
Correct.
Even while a fall, the teeth might go inside the gums or even
Ah.
comes out of the gum. So nothing to worry about it. Just visit a doctor. He will
Hmm.
check, might take some x-rays to verify if any harm is done to the permanent tooth, which
Ah.
follows that. If it's fine, then automatically it will going to come out,
Right.
or any other procedure required, then only it will be carried out.
Right.
Or
Right.
even if there is some swelling out there, then you can
Hmm.
ice it out. Do just stop bleeding. Try to
Right.
give a pack, cotton pack,
Uh-huh.
or apply ice over the face. Then that will help to soothe it out till you reach the doctor.
Right, right, right. Okay. So that's a good. I think it's very important to introduce your child to a dentist. I mean, I for one didn't like visiting a dentist. I still don't. But I think it's very essential to make friends with your dentist. So when would you say, when should a little child see a dentist? If everything is normal, no falls or anything, when should
I
one?
think it's the best gift for a first birthday.
Oh, okay.
You can just start visiting a dentist from the first birthday itself, so that the child gets used to the dental setup.
Okay.
Normally, I have seen people. Why are you scared? I am scared of a dentist. The dentist will remove my teeth. Like,
Yeah.
why should I remove you? Really, I'm not that bad. I won't do that with you. So this fear of unknown, like because
Hmm.
the child doesn't know what is going to happen with him, he's scared.
Right, right.
So if the child is as young as 1 year of age and you regularly take him to a dentist, like at least 6 monthly or once a year, just for a regular checkup, the dentist is not going to do anything. Just check him. If there is any issue, you will be
Hmm.
notified. Otherwise, just a regular checkup or getting used to the dental setup is very important.
Right.
And I must
Absolutely.
tell you, this fear of dentist is going to stay lifelong.
I agree. I agree. Completely agree.
Yeah.
Yeah.
So I think at this age, if there is no fear, I think in future, in case the kid has any kind of problems or even a minor cavity or anything that
Hmm.
goes wrong, he won't be scared to go to the
Correct,
dentist.
correct. Yeah, so it's a good gift to give. First birthday gift is visit to a
Yeah.
dentist.
Yeah.
And there are so many interesting things on a dentist's tray, I think they're very interesting for children, very curious
Yes.
Yes.
kids.
Yes.
So yeah, I think that's a good thing
Yeah.
to think about.
That
So,
should be a regular practice for everyone, rather the parents as well as the kid. Like,
yeah.
if the parents are along with the kid, they also get themselves checked. So
Hmm.
then the kid knows, ki,
Yeah,
yes,
correct,
this is a routine. This is a thing for everyone, not for
correct,
only for me.
correct. So this thing about the tooth that you said putting in the milk, will it work even for adults? So if I break my tooth, can I do that? My permanent tooth, I put it in a glass of milk and take it to the dentist. Will they fix it back?
See, normally it works best for the kids.
Uh,
Yes, in case of adults, it might work, but there are many other things that play a role for an adult. So
yeah.
yes, you can take it as early as possible, but fixing it may or may not be possible.
Right. Okay, great. So with that note, visit your child. A first birthday gift should be a dentist visit. I think that's a very interesting tip, and we should do that. So I might, since I promised that 45 minutes of talk before we open out the session. I would just like to ask you any final tips on do's and don'ts, like setting a discipline or doing anything. What do this, don't do this. Could you just tell us something like that?
Yeah, one is brushing twice a day.
Hmm.
Second, don't put fear in the child. If you don't brush, your tooth will get spoiled. Till then, it's fine. Further, if you go, doctor will give injection, will remove the
Uh,
tooth out. That will get a great fear into the child mind, and he might
Right.
Always
Correct.
not visiting the dentist and that all stuff. That's the main two things.
Correct. Okay.
And we
Great.
also need to motivate the kid for, for everything. Like, since brushing is concerned, if the child tends to copy the parents,
Right.
so brush along with your child. That will really help the child also learn to
Hmm.
brush as well as motivate. Yes, my mom is brushing, I'll also brush.
Yeah.
They tend to copy.
Correct. So
So
you
they
have,
learn to brush well.
yeah. So you should have that good habit. So maybe in the morning they don't see you, but in the night before
Yeah,
going to
sure,
bed,
that's what.
definitely. So you brush with your child. Yeah. I think these are very important tips. So
Yes.
with that, I think we will open out the session for our parents to ask any questions. So there have been a lot of questions down there. So what I'm going to do is I'm just going to read it from the beginning. Feel free to type in, or maybe after these questions have taken up, maybe if some of you want to interact with our experts, that's also fine. So let me just go to the beginning of it. So the right age to use toothpaste. My baby is 21 months old. Kindly suggest good toothpaste also.
Yeah, any company is fine. Just use a non-fluoridated toothpaste and use a pea size toothpaste quantity every time when you brush.
Okay, that is a small dot on your this thing.
That's just a
That's
small
small
dot.
dot.
Because
Yeah.
normally the kids brush because they love the taste of the toothpaste.
Yeah.
There are bubblegum flavors, strawberry,
Yeah.
mango.
Yeah.
The kids brush for that. So the quantity should be less.
Correct. And I think those should be also non-sugary. I don't
Yes.
know.
Yeah,
Yeah,
Yeah.
yeah.
normally they are sugar free, but for now till at least 6 years of age, we need it non-fluoridated also.
Okay, that's important. So my baby is 23 months old now, but she started teething at the age of 16. She has 8 teeth only now. It is a matter of concern, or is it normal? Shall any extra care or something to be done? So
Till 30,
she's 23 months now.
yeah, till 36 months it's fine.
Okay.
After that, any delay, then you need to visit a doctor and
Yeah.
further testing would be required.
Yeah. So I think she has got 8 teeth now. So that's fine, right? No,
Yeah, that's
Absolutely
fine.
fine.
nothing to be concerned about.
No.
Don't
No.
worry, Shilpa.
There are kids who are late, and that's absolutely normal.
Yeah, right. So Priya asks, so my baby is 22 months. When he have new teeth coming out, he gets rashes and redness on skin, some sort of skin allergy. What is the cure for that?
So skin allergy, I don't think it could be because of teeth coming out. It
Uh,
could be because of some products, or parents tend to apply some kind of gels that are available in the market. So the baby
ah,
could be allergic to such kinds, not really due to teething.
Acha. So maybe if you're applying, Priya, I don't know, on the gums, if you're applying something, you're saying that could cause a rash, is it?
Yes, yes, yes.
Oh, okay. So, okay, I hope that answered your question, Priya. Then Rashu asks, how can we stop thumb sucking at the age of 1 year? My baby sucks thumb when hungry or want to sleep.
That
Now,
is the thing, like when the baby is weaned, while normally the baby sleeps after breastfeeding, so this is quite normal at the age of 1. The
right.
baby will slowly develop. You need to tend to find other ways to make the baby sleep, so he stops the habit. Automatically when he's engaged in some other activity while sleeping, he'll
Yeah.
stop the thumb sucking habit, like a story time.
Okay. That's
That
an
can help.
important tip. So, you give something more, give a better goal to your child
Yes.
than a thumb. I say that's a nice tip. I like that because we have so many in Bablr, we have so many books and available story time, and also you really hit the correct note there. Yeah, I think Priya wants to say something as she had asked about the skin rash. Maybe I'll just unmute her. Priya, you can unmute yourself and ask. Can you? Yeah,
Hello.
yeah, Priya.
देखो, usually I don't apply anything. Once or twice I've applied honey on gums.
Okay.
But I've noticed that whenever there's teething process, na, this allergy is severe. Like red rashes, itching, burning sensation, and this kind of things.
Okay.
Usually on legs and hands.
Okay. I think in such cases, I think you should really visit your doctor first, because that could be some other reasons which could lead to this kind of an allergy.
Hmm. Yeah. So, so yeah. So I guess Priya can visit their dentist. A good time to visit
Yeah.
also. Yeah. Okay, Priya, thanks. Um, so we'll just go on. Then Stella says, my baby is 8.5 months old, but he doesn't have any teeth yet. Is that fine? 8.5 months old.
Yeah, fine. No, not in problem.
Uh-huh. So
Not
I
a
think
problem.
you said about 2 years. Did you say
No,
2 years?
till
One and a
14
half.
months, if the no, till 14 months, it is quite normal for the kid to not have any kids. But beyond that, it could be of some concern. So you can just visit your dentist to check it for the same. But yes, till 14 to 15 months, it's quite normal. Some
Hmm.
kids develop, start teething at that age too.
Right. Okay. So don't worry, Stella. Then Mansi says ki, hello ma'am. Hi Mansi. My baby is 10 months old and he don't have any teeth. Neither I see any neither I see any symptoms. Acha, she doesn't see any symptoms of teething also. So
Yeah,
10 months.
that's okay.
Yeah, it's the
You can
same, I
wait till
think. Yeah.
14.
Yeah. So that's good. Then Nishita says my daughter is 3 and she just wants to avoid brushing. What can I do?
Okay.
Yeah. So I
So there are you can start using some music, switch on the music, brush your teeth for 2 minutes, and then switch off the music. It's like playing passing the parcel. So when
hmm,
the music starts, start brushing. When it stops, you can just stop brushing. So that might just motivate the child as a playtime.
right. Okay. So that's an
Or
interesting. So
yeah.
do make activities out of brushing,
Yes, yes,
what you're
yes.
saying. Very
You
important.
can play, you make rhymes while brushing. There are many, many rhymes on brushing. So you can
Hmm.
just, sing along while brushing.
Right. So that reminds me, I used to do one thing with my daughter, when the tooth falls off, वो तकिए के नीचे रखते हैं ना. So
Tooth
I
Tooth
fairy.
added
fairy.
a tooth fairy. So I
Tooth
added one
fairy.
interesting thing. Ki the tooth fairy used to send letters to my daughter. Ki, okay,
Okay.
this tooth looks a bit, tainted. It's got color on it. Have you not been brushing your teeth? So she would always wonder, oh, how does the tooth fairy know? And then to
That's
keep
a
the
good thing.
yeah, so to keep the tooth fairy happy, she would actually brush her teeth, and
Yeah.
then she would get a, oh wow, so the tooth fairy did this. Wow.
The tooth fairy even rewards the kids. So even that
Absolutely.
motivates them to brush well.
Yeah. So you could do something like that, Nishita. In fact, I think even telling about the teeth, like why we have these teeth and different types of teeth, I think that is also a very interesting exercise that you can do with your
Yes.
child. So Varsha says, any tips to clean upper teeth? My kid mostly not allowing me to clean the upper teeth. Acha, the teeth in the upper jaw.
So it's the same thing. Again, you have to motivate the child.
Yeah, yeah.
The same thing, you have to motivate the child. Uh, Basically, use a small brush initially or use a finger brush.
Hmm.
If
Yeah.
you can use a finger brush also for longer time, not an issue.
Hmm. So it's just that you have to turn your finger up and do it, and you have to make sure that the child वो अभी
The teeth
करना
is
ही है आपको. हाँ, नहीं
Make
तो
the child laugh out loud so that the upper teeth are visible. That might
absolutely.
help.
Yeah, that's a good idea. Yeah. Okay, so Sushmita says, at what age we need to start using the brush? My son is 18 months. I think we answered that. But anyway, maybe once more we can answer it.
Yeah, it should be started.
It should be started. Her son is 18 months, so it's time that they started. Right. So when should we start cleaning infant's tongue?
Like we said, since the first week itself, the gum pads as well as the tongue.
Correct. That's important. Then Komal says, my infant is 4.5 months old. She sucks her fingers. Should I give her a teether? If currently it's too early, then by which age should I give her a teether? Which ones are recommended? Water teether or silicone teethers?
See, the thumb finger sucking at this age is very, very, very normal. Like, no,
Hmm.
all the kids tend to do it. And yes, you can start with teething devices in case you feel like, the baby is very irritated. You can start with teething devices. And I prefer like the gel ones are better because you can just refrigerate them and then give it to the baby. That will give a coolant effect, a soothing effect. The baby will
Hmm.
like it because it's so cold.
Hmm.
That will
Correct.
even help.
Yeah. Acha,
And but one thing needs to be make sure that they are clean and sterilized, because just that shouldn't be a cause of any kind of infection.
yeah, some other infection shouldn't happen because of that. Garima says, can we give our child organic teething stick, whole wheat or silicone teacher, which is best? Silicone teether, which is best?
Yeah, like we said, home remedies are the best. They
Best,
work
yeah.
well. So
Hmm.
toast, like a toast biscuit or something sort of that thing, or a apple, a slice of apple, a thick
Correct.
slice of apple, or a pear.
Yeah.
So the kid will develop a taste, as well as that will, they are organic, so it won't harm the kid.
Yeah,
That is
but
under parental care.
correct. You just have to make sure that there's no choking hazard or
Yes,
something.
the baby shouldn't bite.
Absolutely. So that's very important. Yeah. And Komal says, what are the symptoms of teething? What should be done to soothe infants during teething?
Normally, sometimes there are no symptoms also, just the teeth comes out.
Oh, okay. That's
Lucky
nice.
ones.
Lucky
The
ones.
lucky ones.
Absolutely lucky. Yeah.
Yeah.
Hmm.
Or if other thing that, sorry, I didn't get your entire question.
So she was saying the symptoms for teething and what should be done to soothe the infants during that teething period.
Yeah, as said already, that teething toys can be used,
Correct.
a refrigerated toy or with a gel, that would be fine.
But then some kids do have some symptoms, like I think they tend to bite or something like that. No?
They keep on biting.
Yeah.
They can put anything, what they will find, they put in a mouth.
Yeah.
In their mouth.
The kid becomes irritable, and they will just start. Suddenly you will notice that the anything and everything that comes into their hand, they'll just put it in their mouth. That is one sign which like, yes, now the baby started teething, because anything and everything is into the mouth.
Yeah, correct. No, some kids, even I know a child who used to like go and bite people.
Yes.
So that also is a maybe
So
other reasons.
They are irritated. The gums become irritable.
Yeah. So look out for these signs and make they can use as you all suggested teether with a gel and freeze
or
it.
a home teether, like we said, the slice of apple or something.
Correct.
Like that.
Absolutely. Seema says that my daughter got teeth a little late. Now she is 1.5 years old and she has only 6 teeth, 4 on top and 2 lower teeth. Also, her teeth are bigger in size as compared to the teeth in babies.
See, that depends on individual thing, but I think we can still wait for a couple of months more. I think she'll start teething, and once it starts, all the teeth almost come together then.
Okay, so there's nothing to worry about.
Yeah.
She's just
so normally,
1.5.
Yeah, by the age of 2.5 to 3, you have all the teeth in your mouth.
Right, correct.
So it's a long process.
Yeah. So and even if they are bigger, I think that's okay. That's right.
That's okay. We need to wait right now. It's just too early to say anything.
Okay. So hot milk are without boiled. Okay. I think this is referring to the broken tooth. Should we put normal milk? Yeah.
Normal room temperature.
Room temperature. Correct. So should we bring broken milk tooth in glass of milk or adult tooth?
No, it's for the kids.
Yeah, for the child. Yeah.
Yeah, yes.
Correct. Then Bhagyashri says, my baby is 5 months old. What can I do before teething process? Is using a dentonic tablet safe for now?
See, just enjoy the process as the baby is not yet teething.
Acha. So don't do anything. That's
just
okay. So don't use tablets and all, is it? I mean, should they?
Not really. We don't really advise it unless and until some issue is really serious and your dentist has recommended it. Then not otherwise.
Yeah. Okay.
The max that you can do is apply glycerin.
Acha. Okay. Pranjali says, does long-term breastfeeding, almost up to 2 years of child's age, can cause more dental cavities, or does it affect the tooth enamel?
Normally, breastfeeding does not cause that much of caries as much as your outside milk, like any other form of milk causes. But still, prolonged feeding can give you some problems. Like, because of the feeding process, the baby cannot differentiate between the swallowing thing. Because a baby swallow is different when he's sucking and later on. So that differentiation should be started on. After 2 years, like the baby should be able to differentiate. Otherwise, they will develop some other problems with their tongue because they won't be able to swallow it properly because the way the baby breastfeeds and the way the baby eats is different.
Right. So more than being concerned about the dental cavities, I think the whole.
Yeah. The swallowing part
Yeah.
also should be concerned about.
Okay, so that's something to take note of, Pranjali. Somebody has raised their hand, so I'll just take a detour to ask them. Kirti says, my son got teeth a little late. Now she is 15 months old, and he has only 6 teeth, 4 on top and 2 in the lower jaw, and no new teeth from 4 to 5 months. Is that normal?
Yeah,
That's okay.
that's fine.
I think so. Earlier also people have asked a similar question. So there's nothing to worry about, I guess. So Seema says, my daughter doesn't put my finger or brush in, doesn't allow me to put my finger or brush in her mouth, though she loves chewing it. Chewing it on his own. Can you give me some tips?
Yeah, as we already said, you need to motivate the kid for the same. I mean, kids tend to chew on their toothbrush because while teething or there is an irritation, and even that helps.
Yeah, right.
So they tend to, but it's we as parents, we have to do it, and not by force, because something by force is always going to create a negative effect on the kid.
Yeah, absolutely.
So try and make the baby understand. To these days, babies tend to watch videos. So yes, you can show them videos. What happens if their teeth is gone bad, or if they don't brush well? That can help.
Or even a little puppet. You can have a puppet, and then you chew.
You brush it on the dolls or the soft toys, whatever the kid has.
Right. So, and chewing, you can probably explain chewing the toothbrush is not going to help cleaning or something like that. You can make a story around it or something like that. Yeah. So Pramila says, my kid eats toothpaste. Is that okay? No, I don't
know. But yes, kids tend to eat toothpaste.
Yeah. So that's why I think the non-fluoridated ones. Yeah.
Yes.
And so try to you can make it very clear, like you can eat this but not the toothpaste. Yeah, something like that. So Nishan says, does putting hard things in the mouth cause crooked teeth?
No, it doesn't.
Okay.
Not easily, but if there is a habit of putting hard stuff in the mouth, then might lead to a crooked.
After teething, after the teeth have already come and the kid still continues with the habit, then yes, then that can cause some harm.
Right.
Okay. Or even damage the tooth.
Okay. So Zainab says, is tongue cleaning required, and at what age?
Yes, as a same thing from the first week of the childbirth.
Yeah, but I guess that's for the babies, but I think she must be meaning for little older kids also.
Yeah, definitely. So it should be started from that.
It should be started from that. Yeah, but do you that's my question also. Should you use a tongue cleaner to clean, or is just the brush enough?
A tongue cleaner is better because that might help to clean it properly. At times, you feel that vomiting sensation when the brush goes over the teeth.
Correct.
So anytime a tongue cleaner is a better option.
Okay. Jill says, my son is 10 months old and I give him iron drops, which is advisable till 1 year, but because of iron drops, his tongue is getting black. So how can I clean it?
This is one side effect of the iron solution, that the tongue and the teeth might get some stains, but it is not going to really harm the child, and that is a side effect of iron. So you can't really help it or clean it on its own.
Acha, it cannot be cleaned like that. Okay, Amrin, I don't know, you're not able to unmute yourself or what, because I have unmuted you, but I don't know. So when you can unmute, you ask your question or just type it in the chat if you don't mind. Till then, we'll take up some other questions. So Nishan says, my son is 9 months old. He has got 4 teeth, which is okay, I guess.
Fair enough.
I can answer that. So Manisha says, my kid is 15 months old and he has 5 teeth. Is it okay? Yes, it is okay. Then Hamsha says, during teething, Loose motions are common.
Yes.
Yes, very
Okay,
common.
diarrhea. I think you
Diarrhea,
mentioned that.
yes,
Yeah.
yes.
So it's common. So there's nothing to be worried about.
Yeah, but just
Yeah.
avoid, don't put just anything into your mouth. The kid has to stop doing that. Otherwise, this thing will go on happening.
Yeah, right.
And if it continues for a long time, then definitely visit a doctor.
Correct. Right. Then Priya says, my kid is 2 years. She puts the brush inside her mouth and eats the paste and gives me back the empty brush. Wonderful.
Definitely.
Yes.
Definitely, they will do that.
This is one thing that all the kids do.
Yeah, she does not brush her teeth and not allow me also to brush her teeth. I tried brushing my teeth in front of her also, not working still. What are the other ways? Oh, now that's
There are many other ways that we already suggested. Keep trying. Something will work for sure.
yeah. I think using a puppet will help a lot, and you can. My daughter used to ask me, why should I brush my teeth? The dog doesn't brush his teeth. The cat doesn't brush his teeth. Why should I brush my teeth? So I actually gave her a little lesson on how their food is different from our food, and we use cooked food. They don't cook their food, so all
Yes.
that fiber and all that. So maybe you can
That's
do
true.
something like that, Priya. Make the child understand the need for brushing, and I'm sure in a very fun way you can do that. Puppets are, I think, the best way to do it. So, I mean, just a few tips then. Dr. Manisha says, my twin babies are 9 months old and not a single tooth has erupted.
Still
That's
fine.
okay. That's okay. We can wait till 14.
Yeah, till
18.
14 months. Yeah. Then Nishan says again, does putting hard. Oh, I've come back. Maybe it's the same question. So, my question is if use of toothpaste is any harm to his throat or not?
We need a pea-sized amount because some toothpaste have this strong flavor. So that can cause some irritation. So just a very small amount won't cause any problems with the throat.
Acha. And yeah, so the throat, I think they would be mentioned on the toothpaste also, right? What it contains and
Yes.
Yes.
Like all the toothpaste have some strong flavor. The more you use, even as adults, if we apply a lot of amount of toothpaste, we will also feel that
yeah,
strong irritation, the astringent feeling.
correct, absolutely. Yeah. So which toothpaste is good for 14-month-old?
A non-fluoridated one.
Yeah, I can answer that. Anyone which is non-fluoridated. Yeah. So Ishani asks, after what age should toothpaste with fluoride be introduced? My 2.5-year-old has got 20 teeth. He still doesn't spit out, but would swallow the foam. Oh, that's an interesting question.
Yeah. When she learns to swallow, start with the fluoridated. So around after 4 to 5 years would be fine.
Okay. So it's okay. 2.5 is fine. So later on, 4 to 5 years, you should start. And she's got 20 teeth. So I think that's good.
That's normal.
fine.
Yeah, all the teeth have come.
All the teeth have come. Yeah. So and spitting out, she still doesn't spit out. So how? I think that will they
That's
Then
normal.
it does impact.
yeah, it should be
The
encouraged.
kid learns on its own, spitting out.
Spitting out. Yeah, I think it's a natural action. Like even natural action. I know my daughter used to not be able to blow out with her nose. So it took me a lot of effort कि नहीं ये बाहर जाना है बाहर, it has to go out, not in. And
Yes.
that's just something that you and your
Develops,
wife have to do together. Yeah. So Pramila says, my baby is 1 year old. Should I use toothpaste or clean his teeth, or it's only brush?
Yeah. Depend upon how many tooth have come out.
Yeah. So yeah, Pramila. Yeah. So if there are 1 year old should have normally how many teeth, doctor?
Around 4.
4 teeth. So if 4 teeth have come, she should start brushing, I guess. Yeah. And I think now Amreen can unmute herself. She has been able to. Yeah, please go ahead, Amreen.
Hello.
Yeah. Hi.
Hi, ma'am.
Yeah, go ahead.
Ma'am, my son is eight months old and he's suffering from loose motion. Should I give him loose motion medicine or is it normal?
It's usually normal for the kid at this age because the kid might be teething. But if it continues for a long time, then yes, you need to visit the doctor.
Okay.
Ma'am, I'll give him homeopathic medicine for teeth.
So that's your choice. Like, not really, if not for teething actually that you need any kind of medicines, but for any other form of problem like loose motions, it's your choice of treatment.
Yeah, but I think it's good to visit a doctor, I suppose, to
Yes.
check that. Okay, thanks. Uh, so there is one second. Then Varsha says, thanks a lot for your tips. Oh, most welcome. It's a good session. I'm looking forward for more. Sure, we have one every month, so do join us. RSP also says, thanks. Oh, good tips. Which toothpaste brand to start with? Oh, now that nobody's going to answer.
There is a varies of brands, so it's your
Yeah.
choice.
Correct. It's non-fluoridated. That's it.
That's it.
Yeah. So between what age the milk teeth falling process starts and ends?
Okay. It starts after 7 years of age and continues till 12 to 13 years.
Okay. Okay. How Nishan says, how many teeth till the age of 1 is normal? I think
See, it
It
depends.
depends upon the kid. Sometimes many kids have more teeth, many kids have no teeth.
yeah.
So it's an
So-
average number out. So we consider approximately 4 should be fine.
At least 4.
Average. Yeah. Average.
Average,
Sometimes
okay.
it can be less also, it can be more also. No
Yeah, correct. So Lavi says, when we'll need to start brushing to babies? I'll answer that. When the first tooth comes. Yeah. So that's nice. Now I can answer questions too.
Yeah, that's a great thing.
So Ananti says, please tell me about breastfeeding and jaw teeth alignment. Okay.
So, teeth alignment, like breastfeeding, is continued minimum for 6 months, and then it's up to the baby, because normally the baby gets weaned off to other foods and slowly it stops breastfeeding. So, jaw development, the motion of the baby to suck the breast, it helps in the development of the jaw. This motion is not the same in bottle fed babies. So, ideally, breastfeeding will really help make the muscles of the jaw stronger because of the sucking action that they do. The bottle nipple is different. So the sucking action on the bottle is different than on the breast. So that will surely cause less development of the muscles. But yes, they do develop as age goes by. But yes, the stronger muscles are during the breastfeeding. Muscles are stronger.
So that was Ananti's question. And now Millie says, my baby is 5 months old. 2 times I need to clean with gauze.
Yes.
Yeah, that's correct. And Purnima says it's good to use dental floss. And from what age kids should start using it?
After 2 years.
After 2 years.
After 1
Once
or 2
all
years.
the teeth have come.
Okay. All right. And Sushmita says, what type of brush and paste we need to use at the age of 18 months? He has 4 upper teeth and 2 lower teeth. And yesterday he took a pen, ink, and kept in the mouth.
Okay.
That number.
So just use a finger brush. I think that should be fine because that will be easier to clean.
Yeah, right. So I think until your child can hold the brush and brush,
Yes.
you have to do it. And
Yes.
yeah, so Devashri says, my child is 17 months. Her teeth are not fully white, not fully white. They are a little transparent in some places, and it turns purplish when she eats pomegranate. Yeah, I think that happens.
That's
But
normal.
we have not. Yeah, but we have not started brushing. Is it normal? Yes.
No, you need to start brushing.
That's not normal. You have to brush.
That's not normal.
Yeah. So I think right age of brushing, the first tooth appearing. Then Priyanka says, how many days does fever and diarrhea last when during teething? Is it recommended to give paracetamol? Okay.
It depends on the child. Like, not necessary that it stays for long, but if it's more than a week or so, more than 2 to 3 days, then yes, you can visit your doctor and then start with medicines.
Okay. All right. Then the next one is, I think. So Ananthi says, how long we use a finger brush, and what age should we transfer to a brush? I think we just answered that question. So Jill says, my 10-month-old has 6 teeth. Do I need to start? Do I need to start with a toothpaste?
Yes, you can. You
Yeah,
can surely start with a non-fluoridated one.
correct. Yeah, right. So I think we just have time for a few more questions, and then um, okay. So Akanksha says, what oral cleanliness must be done after 6 months? Must be done for 6 months, baby. So
Just
I think we answered that. So that's fine then. Nishant says again, my 9-month-old baby crawls fast and many a times he has fallen over his face with 4 teeth and has cried a lot. How to deal with this situation? Okay.
see, a kid is going to cry when he falls. So I
Yeah.
think not
Yeah.
necessarily related to the teeth, but
Correct.
yes.
That with a bit of some sympathy and like
Yeah.
a little bit of care, advise
Yeah.
the child how move around, and it's fun to fall. And anyway, you learn from a lot of things by falling and getting up and going. Also, you can pacify the child also, and you play maybe a game with the child rather than just maybe letting him crawl around, have an obstacle course or something like that. That will be fun, I suppose. Manisha says, sometimes my baby bites his teeth. Is it normal? Acha, you mean grinds like that, huh?
Yeah, some kids, this time the generation is such that the kids are very hyperactive. So
Uh,
yes, some kids have a tendency of doing that, but it shouldn't be like, it shouldn't stay for long. Like we need to
Break
reduce the
that.
activity and break the habit.
right. Correct. Correct. So it's normal, but don't let it become a habit. And if
Yes.
it is, yeah, okay. Then Akanksha says that share this recording. Okay, as I just joined the session and also okay. So yeah, we will eventually put it on our YouTube. So you just be in touch with our support staff. They will tell you when it is done. And I think we have a few hands raised. If I'm just let me see that. Yeah, I think it's Ishani Muzumdar is asking something. Yeah, you can ask your question, Ishani.
Hello, ma'am. Hello, sir.
Hey.
So I have a
Hello.
question. My 2.4-year-old has got all 20 teeth, but he still has the urge to put everything in mouth, his toys, even his fingers. So is this normal, and how to make him avoid doing this?
So it's just a habit that has formed. So, now we need to give him better options so that he doesn't do that.
Yeah. Yeah. So although it's normal, we should try to discourage him
Yes.
putting things in the mouth. I,
Yes.
I guess that's what you're saying. So yeah. Then who else has raised their hand? Just one second. Sometimes I think they put it down, so I cannot see. Great. I think there are no hands up, and I think we've answered all the questions here. Great, wonderful. That's very nice. Good to know. So, I think then with that, uh, yeah, is there another question there? Yeah. So great. So I think this was a great session, Dr. Gayatri, Dr. Tejas. It was wonderful interacting with you. I think you answered a lot of questions, and it was a fun session. I liked some of the tips that you had given. I wish I knew them when my daughter was growing up. It would have helped a lot.
Yeah.
Nevertheless, thank you so much. Thank you very much.
Thank
Thank
you
you
so
so much.
much. It was a
It's
great
great.
time.
Yeah. Thank you. I hope all our parents also enjoyed. Do join us back again for another session. Oh, wait, somebody, can we take this? Somebody raised a
Yeah,
hand
Yes,
yeah,
just
yeah,
yes.
now.
sure,
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 sure.
sure.
We,
Yes.
yeah, Anis, yeah, you can unmute yourself and ask. Yeah, can you unmute or? Yeah, Anis, go ahead. yeah, I don't know. Sometimes what happens? Yeah, Pramila, go ahead.
Yeah, hello, ma'am. Hi, doctors.
Hi.
Hi.
Yeah, I was really enjoying the session that you had. Thank you so much for all the tips, everything. I really loved it. Thank you so much for that.
Thank
Great.
you.
Yeah, my concern. I have two kids. My daughter is 5 years old. She has a decay in her teeth, but not that much, not completely deep in that. She has a decay. So,
Okay.
is it okay? It is unattended,
No, you need to attend that.
Yeah.
but she doesn't have a pain all the time.
Well,
Sometimes
that's
she tells me,
I think don't wait for the pain to come and just get it done when it's not paining. It will be done within just a one sitting or so and with minimal pain. So even the kid will enjoy the process and he won't be scared. Because once it starts paining, yes, that will be a concern and it will create fear in minds.
okay. But I do took her for the doctor dentist, but she didn't. She's actually started crying, screaming. She was not ready to show her teeth to the doctor.
Yes, so that's quite normal. You can just try and train her for a visit, and you can just show her around the dental clinic, and then maybe she gets used to it. And when you tell her that why is it needed and it's not going to be painful, so maybe yes, she'll ultimately just start let the treatment be done.
Okay, is it normal if they start eating the toothpaste? Is it
Normally, all
okay?
kids do that.
Okay, she literally licked the paste.
Yeah, so
Yeah.
Yeah.
that is the reason we advise a non-fluoridated one for the starting few years.
Okay. All right, thank
Right.
you. And I have another question. My the son is 1 year old, so he's got six teeth. So how do I clean? I have the finger brush is also fine, but how do I brush his teeth with a paste or salt water?
No, you can either use a paste or just with water is fine. Salt water is not really needed.
Okay, just a water.
Yeah.
Okay.
Yeah.
And tongue, everything has to be clean.
Yeah.
Yes.
Okay, thank you.
I would like to add something to this, Pramila. You said about visiting the dentist. In fact, in Bablr, we have, we tell our parents right from in this 0 to 3 years, we have a set of conversations. One of them is visiting your dentist. So what you can talk about, before the dentist visit is also there. So you train your child to think like that, and I think they will enjoy it. Yeah.
Mm-hmm. Sure, Vidya. Thank you so much.
Okay, sure. Okay, I think one last, Anis, if you want to try again to unmute, because I see your hand is up and I don't want to leave the meeting without asking you to ask. Can you try asking a question? Something seems to be the problem. You can't unmute yourself, or you just put it in the chat then if you have a question. Okay. Okay, I guess there's some problem there. Never mind. Okay, so I think that brings us to the end of our session. Thank you very much, Dr. Gayatri and Dr. Tejas. I really enjoyed the session. It was great.
Thank
Wonderful.
you.
Thank
Thank you
you
so
so
much.
much.
We also enjoyed interacting with so many parents. It was a great one.
Yeah. Okay, thank you so much. Have a great day, everybody, all of
You
you.
too. Yeah. Take
Same
care.
here.
Bye bye.
Bye.
Bye.